So mammography or mammogram is nothing but an X-ray of the breast. This is an investigation which we usually do in ladies who are more than 40 years of age. If the lady is less than 40, then we usually recommend an ultrasound. Now, a mammogram is like a simple X-ray for which you go, but in this the breast tissue is compressed between two plates. So yes, mammography can be a slightly uncomfortable, but it's usually not painful. It is painful if you get it done before your periods, which is why we recommend that the mammogram should be done after the periods, a few days after the periods. So mammography is one of the best techniques to pick up abnormalities in the breast. And yes, if there is a lump or if there are changes in the breast, mammography is very sensitive in picking up those changes. The one drawback of mammography is that in young patients where the breast tissue is dense, it might not be very sensitive. So the sensitivity of mammograms to pick up breast problems increases after 40 years of age, which is when we recommend mammograms. So a mammogram is an X-ray of the breast, and if you're scheduled to undergo a mammography, there are certain things which you need to keep in mind. Number one, you should always schedule the mammogram after your periods if possible. Why? A, it will be less painful for you, and B, it will give a better quality picture. Because before the periods, the breast is engorged and tense, and you can have more pain when the breast is compressed. Number two, on the day of the mammogram, take a proper bath, but please don't apply any deodorant or talc over the breast or the underarm region, because this can show up as an artifact or an abnormal finding on the mammogram, and that can cause unnecessary concern. So these are some precautions which you should take when you're going in for a mammogram. So mammography is an X-ray of the breast, and in this technique, the breast is compressed between two plates, and usually there are two views which are taken. In one view, the breast is compressed from above below, and in one, the breast is compressed from side to side. So when the breast is compressed, it can be slightly uncomfortable for the patient. That is why when you're scheduled for a mammogram, try to schedule it after your periods, a few days after your periods, so that the pain is less. If you get it done before your periods, you might experience some bit of pain while getting the mammogram.